Hi, good evening, everyone. We're going to get started in just about 2 minutes. All right, we'll go ahead and get started. Good evening, everyone. My name is Brittany Bosley, and welcome to today's Clinically Speaking webinar on sensory integration. We'll explore what sensory integration is, how it impacts everyday life, and ways to support sensory processing challenges in children. So first, a little bit about myself. I am the director of the Pediatric Occupational Therapy Residency and OT Education here at Ivy Rehab. I am board certified in pediatrics through the American Occupational Therapy Association, and I've been a pediatric outpatient OT for almost 10 years. I reside in Charlottesville, Virginia, with my husband and two small children, and we do have a cat as well. Um, all right, diving in to our agenda. First, we'll start with an introduction to sensory integration. We'll talk about the importance of sensory integration in OT, the overview of our sensory systems, sensory integration difficulties and disorders, and then we'll wrap it up with some intervention strategies and ideas on how they impact sensory processing as a whole. So, what is sensory integration and processing? Sensory processing is kind of the umbrella term. Sensory processing is the brain's ability to receive, organize, and interpret the sensory input we receive from the environment in the body. And so then sensory integration is a specific process within sensory processing. It's how our brain organizes and synthesizes information to produce an appropriate response. So this includes different sensory information from the environment and the body. So this can include sight, sound, touch, taste, smell, proprioception, which is our sense of body, movement and position, as well as vestibular input, balance and movement, and interoception. Our brain organizes this information so that we can respond appropriately. For example, reacting to a loud sound or maintaining balance while walking. When this process works well, we can interact with our environment without thinking too much. But when sensory integration doesn't work properly, it can lead to sensory processing challenges. Sensory processing is a critical part of daily function. It helps us to understand and interact with the world around us. It involves detecting sensory stimuli and interpreting them appropriately, not only for safety, but just in everyday interactions. So not everyone processes sensory information the same way. Some may be hypersensitive, or others might be hyposensitive. And so we're going to talk a lot more about this over the coming slides, but a quick introduction to sensory integration and processing to get us started. It's important to pause and take a moment here to talk about the difference between sensory integration therapy, which is the AIR sensory integration, and sensory-based intervention. While they are similar, there are differences to be noted. AIR sensory integration therapy is a specialized form of therapy developed by Dr. Jean Ayres in the 1970s. She was an occupational therapist, and her life's work was devoted to helping children who have difficulties processing and responding to sensory input. The therapy that she prescribed and has researched is designed to support individuals with sensory processing disorders by using specific sensory experiences to help the brain organize and respond to information more effectively and efficiently. So, with that, we wanted to differentiate between sensory integration therapy and sensory-based interventions. Sensory-based interventions are broader in scope and they're less structured, and there's varied techniques with flexibility between the treatment. Whereas air sensory integration has a theoretical foundation and it requires specialized training and certification beyond a master's or a doctorate level in occupational therapy. So let's dive in to our sensory systems. To truly understand sensory integration, we must first understand our sensory systems. These systems help us process and make sense of the world around us. We're used to hearing about the 5 traditional senses, but there are 3 more systems that play an essential role in how we interact with our environment and navigate daily life. So first, let's begin with our visual system, which involves the eyes, the brain, and the brain's ability to interpret light and color. Vision allows us to perceive depth, shape, colors, and movement. And when the visual system isn't working properly, a person might have trouble with tasks like reading, recognizing facial expressions, or navigating through space. The next one we're going to touch on is tactile system, which is our sense of touch. This allows us to feel pressure, temperature, pain, and textures through our skin. It helps us interact with our environment, knowing when something's too hot or too cold, and identifying textures of an object. Tactile processing issues can lead to over-responsiveness or under-responsiveness to touch, like being overly sensitive to clothing seams or not noticing a scrape or a cut on the skin. The olfactory system is responsible for our sense of smell. Our nose detects chemical molecules in the air, and our brain processes this information to identify scents. Smell is strongly tied to memory and emotion. Certain smells can evoke powerful memories or emotional responses. And so challenges with the olfactory system might involve a decreased sense of smell or an overreactive sense of smell, leading to hypersensitivity to odors that others might not notice. Following that, we'll go to the gustatory system, which is our sense of taste. Taste receptors on our tongue allow us to perceive sweet, salty, sour, bitter, and that umami flavor. Taste is essential for survival. It helps us differentiate between nutritious foods and potentially harmful foods or substances. Individuals who have difficulty with gustatory challenges may experience heightened or reduced sensitivity to certain tastes, making eating a challenge. For example, some may avoid certain textures or flavors due to sensory sensitivities. So those are our 5 basic ones before we head into the 3 not so well-known ones. First, we'll jump into proprioceptive. Our proprioceptive system is often referred to as our body sense. It involves the receptors in our muscles, joints, and tendons, which give us feedback on the position and movement of our body, even when we can't see it. This system helps us understand where our body is in space and whether we're standing, sitting, moving. It's vital for tasks like walking, balancing, and using fine motor skills. Difficulties with proprioception can lead to clumsiness, challenges with motor coordination, and problems such as handwriting, jumping, or even knowing how to grip something or how hard to grip it. The next one is the vestibular system, and this is our sense of balance. It's located in our inner ear and helps us detect changes in head movement and the position of our body in relation to gravity. The vestibular system helps us maintain balance and coordination, and it's also important for spatial awareness. For example, knowing where you are related to objects or on the ground. Vestibular issues can cause dizziness, poor balance, or difficulty with tasks like reading or while moving or performing activities that require balance. People might either crave movement or avoid it entirely. And lastly, we'll touch on interoception. And this is our sense of our internal state of our body. It allows us to recognize those internal cues and sensations like hunger, thirst, the need to use the bathroom, and pain. It helps maintain homeostasis by signaling when our body needs food, rest, or attention to specific physical needs. Interoceptive difficulties can lead to challenges recognizing those internal cues, which may result in missed hunger cues, ignoring pain, or difficulty managing emotions due to lack of awareness of those internal bodily states. So altogether, sensory integration challenges in any of these systems can affect our behavior, our learning, and our social interactions. And so by understanding each of these systems a little bit more, we can better support individuals with sensory processing differences. So why does sensory integration matter in OT? As I've stated, sensory integration is essential for the development of functional skills necessary for everyday life activities. So as OTs, we often talk a lot about activities of daily living. And so those are your basic activities that you have to do every single day to maintain daily life. So that's bathing, grooming, dressing, toileting, and eating. And then in addition to that, sensory integration is very important for learning and academic performance, to focus on a task, managing distractions, and understanding instructions are all vital as we go through schooling to perfect our jobs and what we want to do the rest of our lives. And so the big thing with kids and OT is play and leisure, right? A kid's occupation is playing. And so sensory integration matters because that all impacts a child's ability to play and participate in leisure activities. Social skills, emotional regulation, all these things play into a child's ability to independently play and participate in these activities. So in OT, as OTs, we understand sensory integration can help us identify when sensory issues interfere with a child's ability to function in these areas. And then we can provide sensory integration strategies to calm or alert the nervous system to help children better regulate their emotional responses and react to everyday situations so that they can learn and engage with others. So more specifically, how sensory processing affects pediatric development. Early intervention is key to helping children with sensory processing difficulties develop coping strategies and improve their sensory processing skills. One of the first things that sensory integration affects is someone's motor skills and motor planning. So proper sensory processing supports motor planning, which is also called praxis, and coordination, which is essential for developing gross and fine motor skills to complete those activities of daily living. Children need to process sensory information correctly and accurately to plan to execute movements such as walking, running, and writing. So this starts really young. Attention is another big one that sensory integration affects. So children with sensory processing difficulties may have trouble maintaining attention in the classroom due to distractions or an inability to filter out irrelevant sensory stimuli. I know we've all been there during class and someone else is tapping their pencil and you cannot focus on the teacher because that auditory stimuli is so distracting and you can't filter it out. And I'm sure you guys have come up with a lot other situations that have come to mind. Another reason that sensory processing is so important to talk about and to work on and evaluate with children in the pediatric setting is emotional regulation. So sensory input directly influences a child's ability to self-regulate their own emotions. Overwhelming or insufficient sensory input can lead to emotional responses like anxiety, frustration, or aggression. And last but not least, and this is just a short comprehensive list, but social development is another big one. Sensory processing impacts a child's ability to interact socially on all fronts. Sensory sensitivities can make it difficult for children to engage in group play or respond appropriately to social cues, leading to difficulties with friendships and social connections. So we've talked about why sensory integration matters and how it affects the overall development in the pediatric population. So let's dive into when the brain has trouble perceiving, receiving, organizing, and responding to sensory information in a typical way. And this is defined as sensory processing disorder. Children and adults with sensory processing disorder may experience oversensitivity or undersensitivity to sensory stimuli, which can lead to challenges in everyday tasks and functions. And so here are the three main buckets of sensory processing disorder. First, we'll start with sensory modulation disorder. And so this is difficulty regulating the intensity or frequency of sensory input. So as stated above, the biggest one is the over-responsiveness or the under-responsiveness. And so, for example, you can be overly sensitive to certain stimuli, such as loud noises, bright lights, or certain textures, but you might be under-responsive to not noticing pain or reacting to a temperature change. Each sensory system can be different from each other. So one can be over-responsive and the other can be under-responsive. The second one we're going to talk about is sensory discrimination disorder. This is difficulty distinguishing between different types or qualities of sensory input. So children may struggle to recognize the difference between two similar textures, to identify specific sounds, or understand where their body is at in space. And then the last one we're going to talk about is sensory-based motor disorder. And this is when there's difficulty coordinating and planning motor actions based on sensory input. So this can lead to problems with balance, coordination, motor planning, which affects activities such as running, jumping, and even handwriting. Some common signs and symptoms between all three of these, but not all inclusive, can include behavioral symptoms such as avoidance of certain sensory experiences, such like engaging with Play-Doh, going to the pool with that chlorine smell, certain sounds like a parade with fire engines and fire sirens, or certain activities. Overreaction to sensory stimuli can become so upsetting or provide such an anxious experience that the child just automatically will shut down and not want to complete it, which can come off as a behavioral symptom. Some physical symptoms that you might see are clumsiness, excessive fidgeting, or movement in an attempt to self-regulate, or difficulty with fine motor tasks like holding a pencil or using scissors. It's also important to note that sensory processing disorders often co-occur with other developmental or neurological conditions, such as autism, attention deficit hyperactivity disorder, anxiety disorders, and learning disabilities. And here's a quick slide of some of the assessments that you can utilize in the outpatient setting when looking at the sensory integration. So while we do have a few standardized assessments, such as the Sensory Profile 2, the Sensory Integration and Praxis Test, and the TSI, clinical observation continues to be the main source of assessment for children with sensory integration difficulties. Because everyone is so different, no two people are the same, it is vital for OTs to observe play behaviors, reactions to sensory stimuli, and functional skills during that therapy evaluation to truly get a well-rounded or holistic view of that child and their sensory system. So with sensory integration and some related interventions that we'll talk about soon, we do want to keep in mind that when we do treatment planning and goal setting, that our goals remain SMART goals. And so SMART goals are goals that can be used to track progress, guide treatment plans, and ensure that therapeutic interventions are effective in improving our sensory processing skills. So we'll go through each step of the SMART goals for sensory integration. So when setting sensory integration goals, specificity requires help to target particular sensory challenges or behaviors that need improvement. In sensory integration, this could mean quantifying the amount of time for the M measurable, the time a child can tolerate certain sensory inputs, or the frequency in which they engage in specific sensory behaviors. Achievable, A. It's important to set goals that are a challenge, but don't overwhelm the individual. So gradual steps towards the larger goal ensure success and avoid frustration. R. Relevant. Sensory integration goals should target skills that improve the child's ability to participate in everyday activities such as school, social interactions, or self-care. And then the last is time. Time limit creates motivation and urgency to stay on track to accomplish the goal within a reasonable period. All of these things go into hand in hand when creating treatment planning and goal setting for kids with sensory processing difficulties. Occupational therapy is one of the most effective interventions for managing sensory processing difficulties. OTs use sensory integration techniques and strategies to help children process sensory information more effectively and to develop strategies for self-regulation. So there's really two main parts of treatment of sensory integration in the OT outpatient setting. You have the individualized approach, right? So tailoring sensory activities based on that child's needs, their sensory preferences, and their goals. And then the therapist's role in that, which is to create a sensory-rich environment that promotes appropriate sensory input and motor planning. And that therapist's job is to provide opportunities for adaptive responses, which are strategies to help the child respond to sensory challenges on their own. And so we really want, as OTs, to have our kids that we see be able to generalize, not only have them utilize these strategies in the therapy session, but utilize them out in the real world where they're going to not have someone right by their side to help them or cue them to use these strategies. We want them to be independent in utilizing these sensory strategies. So here's a quick example of what some sensory integration treatment would look like in an outpatient setting. So a quick example background, a 5-year-old child is overly sensitive to touch, frequently resisting wearing certain fabrics or getting messy with activities such as finger painting or Play-Doh. They express fear and discomfort in the environment with bright lights and loud sounds, becoming upset during group play with other children. And so you see this child, you're in an evaluation, and the parent or the guardian is telling you these things. These are all things to keep in mind as you go into the assessment and then as you plan out intervention. And so what we would do is then we would encourage progressive participation in activities such as touching messy textures or substances like finger Play-Doh through a bag or sand that's in water. And so we would also recommend the use of adaptive clothing, such as seamless socks and soft fabrics to reduce discomfort for this child. And what we'll see is that the outcome is to improve the child's sensory integration, their emotional regulation, and functional skills so that that child can enhance their participation in everyday life activities during group play by themselves and participate life fully as a child. So some of the things to consider when creating a sensory-friendly environment for sensory integration. Sensory-friendly environments are designed to reduce sensory overload and provide a calming or supportive atmosphere for individuals with sensory processing difficulties. These adjustments can be particularly beneficial to children with sensory processing disorder or those on the autism spectrum, but they can also help anyone who's sensitive to certain stimuli. So some considerations for the environment, as an example to keep in mind: lighting. Natural lighting is preferred versus artificial lighting. So thinking about what kind of harsh lighting might be in the clinic or at home, neon lights, things like that. So that warm light is more beneficial for kiddos or those who are sensitive to those lights. Noise. So sometimes background music or white noise can be helpful to children who are hypersensitive to sound, or the total opposite, noise canceling headphones. You can also provide different things like sound absorbing materials such as curtains, carpets, or acoustic panels to minimize echoing sounds for those who are hypersensitive to auditory stimuli. Smell, this is a huge one. So keeping in mind natural scents, ventilation, strong odors from cleaning products or food. Kiddos that are hypersensitive to these smells can pick up on them so quickly. And so keeping that in mind when creating a sensory-friendly environment is very important. Space, so ensuring ample space for children to move freely, open floor area, being mindful of color choices such as neutral soft colors are better than harsh clashing neon lights and colors. Soft materials, soft fabrics for seating and bedding, thinking about cotton or velvet to provide tactile comfort to those who are sensitive to textures. And then some tools and equipment that we can utilize for sensory integration, swings, therapy balls, tactile toys, weighted blankets, and the one that everyone knows, fidgets. Fidgets have become so popular in the last few years, and they truly can be very beneficial to those who do need them in the home, in the classroom, or out in the community. So, what is a sensory lifestyle? So, a sensory lifestyle is a personalized approach to incorporating sensory strategies throughout the day to help individuals manage sensory processing challenges. It's not just about the therapy sessions, but it's about integrating sensory regulating activities into daily routines. When you look at it from this approach, this holistic approach, it helps individuals with sensory processing difficulties or other sensory challenges better manage their sensory experiences in the real world setting. The goal is to create an environment and routine that fosters self regulation, emotional stability, and functional participation in the home, school, and community. And so it's really important to note that sensory lifestyles is customized to each individual child or person based on that person's unique sensory profile. Whether they need calming input or more stimulating experiences, it's going to depend. And sometimes it depends on the hour, on the day, depends on how that person slept the night before, what they ate. A lot of factors go into what a person's unique sensory profile looks like at any given moment. So here is a quick example of what a sensory lifestyle could be. So it could be that this child seeks out heavy work. They need that proprioceptive input first thing in the morning. So maybe we can have them push a laundry basket full of canned goods down the hallway, back and forth 5 times. And then they're able to get ready in the morning, brush their teeth, brush their hair, get their clothes on, things like that. They might need activities that involve movement. So they might need to spin around 3 times and jump on a trampoline outside for 5 minutes before catching the bus. Different things like that can help stimulate the person's sensory regulation system and that nervous system to create that optimal level of arousal in which that child can participate independently and do the things that they want and need to do. Activities involving, textures. So like having a fidget that has different textures on it so that that person can pull it out of their pocket at school and they're able to touch it, feel it, and then they can, pay attention to what the teacher's asking them to do and follow instructions. So every person's sensory lifestyle or routine is going to be very, very different. And that is what brings me, in the next couple slides, we'll talk about some challenges with sensory integration as well. So a quick note on coding and billing just with sensory integration. There is a CPT code that we utilize as occupational therapists for sensory integration. It is a general code that aims to help children with sensory processing disorders. It is important to note that billing for reimbursement of CPT codes is challenging and that coverage can vary between insurance plans and state to state. So it's important for us OTs to know what each child has for insurance and then what are the guidelines and rules for the state that you're practicing in. So some challenges with sensory integration. And so the first one I want to touch on is individual variability. And I think we kind of touched on this the slide previous to this one, but each child is unique and their sensory needs may vary greatly. So what we need to do as OTs is each individual has a unique sensory profile, which means that the sensory needs and sensitivities vary greatly from one to another. So we as OTs need to be aware that some individuals might be hypersensitive to sensory stimuli like sound or touch, while others might be hyposensitive and need more intense input to react. So it can be difficult for us therapists and OTs to create a one size fit all treatment, and that's not going to happen because each person's sensory needs must be individualized, assessed, and addressed. The variability often requires frequent adjustments to therapy plans, making it harder to predict what strategies will work best for each child. Sensory integration, heading into this second challenge, doesn't occur in a vacuum. Families, schools, and environments play a significant role in the success of OT and sensory integration. So it can be a big challenge if families or caregivers aren't adequately educated or involved in the therapy process. It can be difficult to have the therapist try to reinforce those sensory strategies at home or the community. Additionally, environments like schools may not always be sensory friendly, which limits the generalization of skills learned in our therapy sessions. And lastly, measuring progress. Sensory processing is often so subjective and difficult to quantify. Unlike physical milestones, improvements in sensory integration can be subtle. It may not always show up immediately in one way that's easy to measure. For instance, a child might tolerate tactile experiences more successfully, but improvement may be gradual and not easily observable. Without clear, objective measurements of sensory integration progress, it can be tough to gauge the success of therapy or set precise goals. It can also be challenging for families and professionals to see that progress over time. It's quite a challenge and a balance to get parents and caregivers involvement. And I always tell parents that it is a journey, and we are taking little baby steps. When we look back, we'll see the progress that we've made. So best practices for sensory integration. First and foremost, we should have a child-centered approach. The activity should be engaging, fun, and motivating. Sensory integration should be embedded into play-based interventions and be actively engaging for that child. Children, in particular, benefit from play because it allows them to experience sensory input in a natural and enjoyable way. The next one for best practice is the graded exposure. So gradually introducing sensory experiences to increase tolerance. Therapy should be progressive and gradual in terms of introducing new sensory challenges to that particular child. And collaboration. So collaboration with families, caregivers, and teachers is essential for reinforcing strategies across all environments and ensuring consistency across all the settings in which a child will be at. Consistency in sensory strategies ensures that an individual can generalize the skill, leading to better long-term outcomes. And last but not least, and I think the most important one, sensory integration should always be focused on functional integration, meaning that therapy should aim to help the individual engage in real life activities, things that they are doing day in and day out, into those daily routines. We don't want to focus on something that doesn't impact the child. If that child is never going to be near something like a wool texture, then why should we help them work on being comfortable with the wool texture? So things like that, we want it to be functional for that individual. And wrapping it up with research and evidence, the research on sensory integration therapy presents a complex picture. While sensory-based interventions are widely advocated for, there's a lack of empirical support, leading to disagreements over their therapeutic values. This is attributed to the methodological challenges and confusions with similar approaches. Emerging evidence with improved methodologies is beginning to shed light on the potential benefits of AIR's sensory integration therapy. So, for example, overview of studies that support the effectiveness of ASI therapy in improving self-regulation, motor skills, and adaptive behaviors has been done. And we're seeing more and more research come out that in the support of the effectiveness of AIR's sensory integration therapy. But there's ongoing debate and need for more research in other areas of sensory integration based interventions. And that's why it's important as we advocate for our profession that we need more research and we need to have that backing all of our interventions and strategies that we utilize with our kiddos day in and day out. And so that wraps up my portion of this clinically speaking webinar. I will open the floor to anyone who has any questions. I do want to thank you all for joining. If you have any questions for me on the clinical piece of this, please feel free to jot down my email and send me an email. I'd love to chat any and all things sensory integration. But if there are no questions at this time, I'll pass it over to Christina for her portion.
Thanks, Brittany. Thank you so much for teaching us about the sensory integration, and thanks everybody for attending. My name is Christina, and I work on our talent team here at IV Rehab. If you're interested in joining the team, whether that's working in the clinics and treating patients, or even becoming a de novo partner, please feel free to take down my contact information. You'll see my cell phone and my IV Rehab email address. So you can take that down, or you can also look at opportunities on our website under the careers page. But would love to connect with you about any future opportunities, or if you're looking for something right now. So thank you all for attending and have a wonderful evening. Anything else that you wanted to speak on, Brittany?
Thank you, Christina, and thank you everyone for
Thanks,
attending.
Brittany. Thank you, everybody.